I think that there's really the bright spots you have to kind of look for with a fine tooth comb, but the zero copay, for behavioral health and substance use care is important. The Medicaid is, historically not had copays for services for treatment. And so having that carve out for our population is really important. And that goes for FQHCs, CCBHCs, and rural clinics. And, so that's really, if people don't know that, I would absolutely provide that information and education to providers in our space. The other bright spots are the broad exemptions for medically frail, so to speak, people and SUD treatment. Um, that would I would consider be really, really difficult, if not a complete stop to care in some cases, if we had to apply those work requirements. And then a small one that, I don't think is very small, but it isn't getting a lot of airtime, is that there was in the Senate version of the bill that was signed into law, the removal of a proposed ban on gender affirming care. And so, those kinds of things I think really need to be, more publicized because it's easy to get doom and gloom, right? I mean, you could probably spend the entire time talking about that, but without looking at some of the upside, if you want to call it that, it does, in my opinion, stifle innovation. And so that's really the last thing I'll say is that it provides, space, and action for innovation and for creativity and for providers to, get with their executive teams and strategize about what they're going to do differently and maybe what they're uncomfortable with because of whatever reason and embark on something new that will sustain and stabilize their organization and the system at large.